No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center. Hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter total.
Thank you for a lovely AVD ICVD 4 Congress in Pune. It was a grand success, more than 565 people. Dermatology is alive and kicking. AVD is going great. Drools is a great sponsor. Please do help Drools with all their products. Today we have one of the superstars of veterinary dermatology in India, Dr. Madhavi Awale. I hope you enjoy her talk right now. And over to you, Dr. Madhavi.
Yes. So before Dr. Madhavi takes over, let me introduce the speaker. So Dr. Madhavi completed her BVSc and AH from Bombay Veterinary College in 2010, followed by a master's in veterinary pharmacology and toxicology from Sardar Krushinagar Dantewada Agricultural University, Gujarat. She worked as a senior research fellow at the Department of Toxicology, National Institute for Research in Reproductive Health, Mumbai, before moving to Pune, where she established her private practice. Today, Dr. Madhavi is the Chief Veterinarian and Practice Owner at Pet Wellness Clinic and Derm Center in Pune. She is a life member and administrative committee member of the Indian Association of Veterinary Dermatology, a full member of the Asian Society of Veterinary Dermatology since 2018, and a member of the European Society of Veterinary Dermatology since 2023. And before we start, I would like everyone to please fill out the form in the comments box to receive your certificates. And now over to Dr. Madhavi Awale for her expert insights.
So first of all, first I would like to thank AVD for giving me this opportunity, and I would like to thank Drools for coming up with this webinars, which is actually helping on both sides for us also, and all the vets in all pan India to get this exposure, to get this way to learn sitting at home. And I would like to thank everyone that it's a Sunday and still everyone are here on a Sunday. You want to spend time with a family, but everyone is here. So already we are running late, so I'll start with my presentation without wasting much time to do. So today my topic is how to approach a pruritic dog. Now, first is, what do you know about pruritus? I'm going to go a little fast with certain things because of the time constraint. But wherever I'm going too fast, please, you can just put it in the comment box that I'm going too fast, because I've got this comments that I speak a little fast in certain places. So let's talk about pruritus. Pruritus means itching. We all know that most of the patients that come to you, the most common cases of dermatology or skin patients that come to you come with a common problem of itching. And not only it affects the dog's life, the living life, but at the same time, it is very frustrating for the pet parents. And ultimately, it gets frustrating for us because we are not able to handle. So, what is pruritus? Pruritus means itching. It's an unpleasant sensation where the dog wants to scratch, wants to, bite. But earlier, the word scratching was something that we used in front of the pet parents. Today, I would not like to use the word only scratching because the pet parents have evolved. So I like to go with the words whether he's licking, whether he's biting, whether he's chewing, whether he's rubbing or rolling. I'll talk about that in history taking, but this is also important to understand that only scratching is not the word. When you ask a client, you ask the other words also because that is what the owners miss and you do not understand that this could be a part of pruritus only. Now, how do you approach? First, I need to take the history. When the dog comes to the clinic, I need to ask the history. I need to physical examine him. Then I need to do a diagnostic approach. And then finally, I know that I have got the diagnosis. So now I'm going to talk about management. Now, when I'm talking about the management, means most of the time, pruritus is not about treatment. It is about management, like a topic. You do not have a treatment, but you need to manage the pruritus just so that the client is happy, the dog is happy, and ultimately you are happy because otherwise the owner wants to kill you or want to give a bad review to you. Now let's talk about history. The first question is, does your dog lick? Does your dog bite? Does your dog chew, rub, roll, scratch, or scoot? Please use these words very commonly. I used to work, I'll just give an example. I had a beagle, had come to my clinic, and I could see that there was complete, kind of a pustules. There was erosion on the chin, and I asked the client, is he scratching? And the client is like, no, she is not scratching. And I'm like, but I can see the lesions. Again, I asked the same question, is your dog scratching? And he's like, no, she's not scratching. And then I realized that actually, then I asked him, is she rubbing? And then he was like, yeah, she is rubbing. So you know what? You say a scratching, the client says, yes, it is not scratching. But no, the dog is also could be rubbing, the dog could be rolling. Sometimes it can be the licking, especially when the paws, when I talk and I ask the client, is your dog biting or chewing? And they say no, but I can see the salivary staining on the paws. And that's when I ask that, is your dog licking? Because I can see the salivary staining. That's when the owner says, yeah, she's not biting, but she is licking. So understand these words have to be used on a regular basis when you're asking the history. At what age did you first notice the itch? For example, you all know when it comes to a topic, it has to be between the first 6 months, the 6 months to 3 years of age. So you have to ask not when the lesions have appeared, but you have to ask when the dog started scratching. Might be the dog came to you when he's 4 years old or 5 years old with a lot of lesions. There are a lot of erosion, there are a lot of furuncles on the paws. But ask, when did you first see the dog scratching? The lesions appeared when he was 4 years old, but might be the dog had started scratching when he was young. Where on the body is the itch? Now, when you ask the client, where is he itching? The first answer that you get from the client is the dog is scratching everywhere. Please do not appreciate that answer. Ask them, no, I want you to show on the body where. No, doctor, he's scratching everywhere. No, I want to specifically ask and show me where your dog is scratching, because the parts of your body, for example, the ear pinna, you're talking about the axilla, you're talking about the groin region. That means your dog, you're talking about a topic. But if it is on the ear pinna, but at the edges, the margins of the ear pinna, that means the dog is scratching on the because of the sarcoptes, on the elbows, sarcoptes, okay? Is the itch continuous, seasonal, or intermittent? What came first, the itch or the rash or the skin changes? This is a very important question when you ask to the client. If the itching came first and then the rashes, that means you're talking about secondary infection along with something primary like an atopic, some kind of allergy, food allergy, FASS, But if the rashes or the skin changes came first and then the itch came, that means we are talking about some things like, vascular changes. So understand that whether the itch came first or the rash came first and the itch, these are very important to remember. Have you given any medications for the itch or any other conditions? If you're giving glucocorticoids, see whether after giving glucocorticoids, did it resolve? I had a Shih Tzu puppy, had come to the clinic, and he was non-stop scratching. It was a puppy around 4 or 5 months probably, and this dog was already kept on cyclosporine, glucocorticoids, hypoallergenic food, everything. But the owner kept insisting that in spite of giving glucocorticoids or the cyclosporine, it didn't. So I asked whether it increased, and they said yes, it increased. That's when tube light, in my head. I was like, no, something is not right. It is not glucocorticoid responsive. So I asked him specifically, show me where he is scratching around the ear pinna. But when I checked, I did clip the hair around the ears, ear pinna, and I realized that there was like a scab, on this, around the ear margin. I did a scraping and I saw that there was sarcoptes. So understand, it was not about allergy, it was just because of the scratching due to sarcoptes. So always understand that if there were glucocorticoids or any medications were given, ask if there was any changes to the itching. Now, next is physical examination. There are three major aims when we are doing any examination. Physical examination, absolutely important. I have no idea when, the clients ask me this question that I'll share you the photograph, online. If you can help me with the case, it's very difficult. It's not possible. It's virtually not possible unless and until you check. Unless there's a veterinarian involved, I do not appreciate that the dog has to be given medications on phone, at least for dermatology. So always check whether the body condition as well as the hair coat. When you are looking at the hair coat, just don't look at the hair coat, but look at the body condition. See if there are parasites or any lesions are appear. When the owner is saying scratching, just don't say yes, okay, he's scratching. Look where he's scratching. Are there any lesions? Is there erythema? Is there redness? Is there some kind of scab? Is there a pustule? Is there a papule? And finally, the distribution of the lesions. Now let's talk about the general body condition and hair coat. Check for the hair coat for density, whether it is normal, if there is sparse, if it is absent, when you're talking about is this hypotrichosis or is it alopecia? पूरी तरह से बाल गए, or is it just that there is a little bit of hair thinning is there? Run your fingers around it so that you realize you can feel the scabs, you can feel the pustules, you can see the papules, as well as you actually understand where, because especially in a husky or in a golden retriever, you cannot observe each lesion by looking. Just run your fingers, and wherever you feel that bumps on the skin, there you can start observing. Dry, coarse, if it is greasy, if it is greasy, you are dealing with malassezia. If it is sticky to your hands, you are talking about something like malassezia. Screen body for signs of systemic disease. Body condition is very important. If I see a dog who has become fat, he's obese, he's a lab, where I can see that he has bilateral alopecia, but when he came to the clinic, he's very dull, he's walking very obese. When I'm trying to look, he's so tired, he doesn't even want to approach, Yes, old age, possible, I can understand, but still, I can see that he's putting on weight. There is a rat tail condition, that eyes are like, droopy. I'm looking at hypothyroid. So understand these things also. If there is muscle wasting, if the patient demeanor is different, you need to understand that skin does not affect. Dermatology does not tell whether it is only about the cosmetic. Sometimes you understand the condition of this body, or you can actually detect the diseases way before any other signs just by looking at the skin. So identify the lesions and parasites. Major lesions in the pruritic dogs are change in the skin color. I'll go directly in the next. For example, changes in the skin color. Either there will be erythema, there's extreme redness. You can look at the Shih Tzu. The entire neck is completely red. He must be scratching for so long. It is completely inflamed. Then comes hyperpigmentation. This is a pug, the classic skin is black, is thick. There is hyperpigmentation. There is, you can see that blackening of the skin. Then comes rash. Check whether if this rash is like a macule. Macule is something that is flat, but it is circular. Check if it's a papule. Papule is where it is raised, and it may be hidden under a crust. Check whether it is a pustule. That classic pustule, you have that yellow sac of pus. See if there's a scab formation. Scab, obviously, if it is there and you do not see a papule or a pustule, that means there was a papule or pustule before and now it has converted into a scab. Epidermal collarette, if most of the clients which come to me, they with the epidermal collarette are where the owner or the primary vet has treated with for fungal. So what happens when epidermal collarette is, because the lesion is circular, you see that the hair, you directly connect it to a dermatophytes or a fungal infection. Please understand, see the difference if it's an epidermal collarette or it is some kind of a fungal infection. Here you can see the classic, pustules. The first case on the left hand side where, you can see it is a classic pustule, and this is a case of demodicosis. I just squeezed that, pustule on the slide, and I saw in that, fluid on this slide, a lot of demodex. Pustular diseases, one of it is always pyoderma, and second, it can be demodex. Then this is a macule. This is actually a case of pemphigus. Actually, we detected it as a pemphigus foliaceus, but you can appreciate the red macules. Then in this, you can see the epidermal collarette, which I was talking about. You can see the circular lesions. You can easily get a little confused that this could be a fungal infection. So please, the best way to identify, you can just do a cytology. If it's a fungal infection, you'll find those kind of spores. If it is a bacterial or epidermal collarette, you will find it as a pyoderma. The case on the next side is the same dog I was talking about, pemphigus foliaceus. Look at the scabs. You can appreciate the scab formation. I hope I'm not going too fast, because this is a very big vast this. I'm going to go a little fast where it's not necessary, because I know you all are knowing about it. Then comes the loss of hair. This is a classic case of alopecia X, this Pomerian. There is hypotrichosis, there is alopecia patches, the hair has lost, but there is no erythema, there is no redness. Of course, you'll be confirmed it with a biopsy. And the other one is a patch where you can see it is hypotrichosis and alopecia, there is hair loss. Then comes excessive scaling. When there is scaling, you actually find that there is a excessive accumulation of the dandruff. Okay. Now, if it is scaling and this is a dandruff, does not mean again that it is a fungal infection. That means it could be just scaling. It could be like for an ichthyosis. We had a case of ichthyosis. Second is seborrhea. Seborrhea, it can be where there is excessive scaling along with greasiness. It can be sicca. It can be oleosa. And then again, I'm talking about epidermal collarette, where you can find that there is excessive scaling around the edge of this collarette. This is a case of sebaceous anoditis. You can actually see the hard seborrhea all over, the scaling. You can actually find that if you try to scrape it off, they are adherent, it sticks to the skin. It's a beautiful case of sebaceous anoditis, very commonly seen in German Shepherds. Then comes changes in the skin thickening. We know about lichenification, where there is thickening of the skin. For example, this. You can see these are two cases of lichenification. The first case where you can see this, it is like an elephant skin. There is thick skin. You actually cannot go and feel the, subcutaneous also sometimes. It is that thick like an elephant. And this is, lichenification in a chronic case of otitis of an atopic dog. So lichenification is very commonly seen in Malassezia due to atopic or chronic atopic dermatitis. And this is a beautiful case. We have fortunately been able to treat it. This is, you can see you can appreciate the skin. This is actually just a 3-year-old German Shepherd, but because of non-stop application of a steroid cream on the skin, he was actually some food allergy and dermatophyte infection, but the owner kept applying the steroid application for almost 2 or 3 months. I don't know how much, I don't remember that. But look at the skin. It's become like an old man's skin, So this is an iatrogenic Cushing syndrome, where you can see the skin thinning. There is cutaneous atrophy. Now let's talk about the defects in the skin integrity. Defects in the skin integrity means your skin is not in a continuous manner. There will be a break in the continuity of the skin. Now excoriation is where the dog has scratched, and once there is scratch, there is just a self trauma, but it is very superficial. But if that erosion, it goes a little deeper, you'll find that there is an erosion and ulcer, where ulcer has entered into the epidermis, not just the stratum corneum, but also into epidermis. And furuncles is where there is, the follicle, the hair follicle is affected, which is quite deep. You can say a case of deep pyoderma. So this is the photograph. You can see that this is just excoriation as well as erosion. But this, you can see there is a depression. I can actually put two fingers, inside. This is a case of an ulcer. And this is furuncles. You can actually appreciate. And furuncles, very commonly seen in chronic atopic dermatitis. So let's talk about the distribution of the lesions. Distribution of the lesions is mainly because of the infectious skin disease. Second is the parasitic skin disease, and third is the allergic skin disease. I'm talking about something that is very commonly seen in our day-to-day practice. I'm not going in anything fancy, in nothing in detail. This is something that you see in a day-to-day practice, at least 5 to 6 patients, I'm sure. So infectious skin disease. First is the pyoderma. We all know bacterial infection. It can be acute. Acute is where you see these papules, you see pustules. Again, the same thing. I'm talking about epidermal cholera. But chronic is where you find lichenification. There is thickening, there is lichenification, there is hyperpigmentation, there is greasiness and scaling. Always remember, pyoderma can be superseded with malassezia. Okay, this is very important. So there is a possibility that you see a pyoderma and a malassezia. But when you are dealing with these two, you have to understand this is not a primary cause. This has to be secondary. So if a case comes to me for pyoderma, if a case comes to me to malassezia, I need to tell the owner, see, you know what? I will treat you right now. I will treat your dog right now, but I'm not saying that this will not recur. This will come back again, and I need to figure out why it is coming back. I'm talking about atopic, I'm talking about allergy. I can be talking about some kind of a hormonal, like a hypothyroid. I'm talking about something like a Cushing syndrome. So you have to understand that this could be just the start, and there may be something that we need to go further. This is the same, I'm talking about pyoderma. This is again the epidermal colorate, and this is the pustule. So malassezia. Now comes the malassezia, just like I was talking about staphylococcus, and the second is malassezia. You will see that in atopic and malassezia, the distribution of the lesions is classic. It's on the muzzle. You'll see around the eyes. You will see the ear pinna. Not the ear margin, but the ear pinna. You can see on the neck. It's always there. Yesterday itself, I had a dog, golden retriever with malassezia. From ear to ear, it was entire hyperpigmentation. I tried to touch. In fact, the slide which I took also, to confirm that it's a malassezia, there was a greasy layer as if some oil or butter I had applied on the slide. You can see on the axilla, and you can always see around the, groin region as well as the perianal area. This is a pug I was talking about. You can see how thick it is. And you can actually, in the photograph also, you can appreciate that it's greasy. This is about the ear pinna. It's a chronic case of malassezia, and these are both cases of atopic cases. I'm talking about atopic because this, I think, I'm sure everyone will agree that at least you maybe see atopic dogs are so difficult to manage, and especially during the seasonal flare. All my patients of atopic, they are so doing well throughout the year, but the moment rains start, there's frustration, the owners are frustrated, and they come to our clinic. This is dermatophytosis. Now, dermatophytosis, we are talking about trichophyton, and you're talking about microsporum. Microsporum is very commonly seen in case of, cats. But I have seen in dogs also. So I have put photographs of dogs here. This dog actually, if the first photograph, the dog came to me, say, he came for vaccine. I saw this patch and I asked the owner, why is this patch there? And they said, I think he got hurt while playing with my other dog. So I'm like, okay. But as we are used to it, we just quickly took a wood lamp and we checked. And you can see that classic fluorescent green color. And we did confirm it with a trichogram, and it came positive for, the spores. So we confirmed it as microsporum, and we started the treatment. We just clipped the hair and we just did the application. But understand that sometimes the owner itself doesn't know that this is actually a dermatophytes. But here you can see it is very different than epidermal collarate. In epidermal collarate, you can see that a ring is there. You can see a demarcation. Whereas in case of dermatophytes, you don't see that classic demarcation. This is another dog. You can actually see he came for alopecia, but we did the Woods lamp examination and you can see the classic fluorescent green color. Then comes the parasitic skin disease, flea allergy, dermatitis. I'm going to go very fast. You all have, know about FAD. FAD can be acute, it can be chronic. Most of the cases, the dogs, patients which come to are acute because owners, we don't see that bad. But in case of chronic, I see in stray dogs which come to us, the volunteers when they come to us, we have seen that sometimes the flea is not there on the body, but you can actually see on the dorsal rump area, there is entire lichenification. You can see there's alopecia and the dog is non-stop wanting to scratch. So anytime a dog comes to me with a patch on the rump area, I am looking at fleas. And for fleas identification, it's very important. Not necessary in one go of your flea comb, you'll find a flea. You have to do repeated attempts so that a flea can be seen on the comb. Okay, this is just a hotspot or moist eczema dermatitis. Sarcoptes scabies. We all know Sarcoptes scabies, but still this is how sometimes we miss. As I mentioned about this case of a Shih Tzu puppy. The only problem what happened with the primary vet is that they didn't check the ear pinna. They did check that this dog is scratching. They actually treated for otodectus. They checked for otodectus. There was no otodectus for that. But still the dog was scratching, so they thought that it could be a food allergy. The simple way is, if you have a dog, always feel the margins, and this is difficult, especially in those dogs who are very hairy. Because because of the hair, you are not able to see that classic scab on the ear pinna. Yes, it is seen on the hock joint, on the elbow joint, but that's something not very commonly seen, especially when pet parents come to us, they come in the initial stage. So you might not see this classic lesions because it's seen in a little severe cases. So I can show this. This is a classic Sarcoptes. You can actually see it's of the same Shih Tzu I was talking about, right? Okay. Then this is another dogs. This is a group. Volunteers had come with some stray dogs. Demodex. Now, Demodex is something it's more than my favorite. It's one of my staff's favorite. I don't know why. Sometimes whenever he looks at a simple puppy has come to me for vaccination, he makes sure that it is checked properly. And sometimes there is a simple patch, simple alopecia patch, and he tries to figure it out that this could be Demodex. I have told him multiple times, you know what, the dog has come for vaccination. Don't start searching. And he's like, no, ma'am, I'm not searching for Demodex. It just comes. So understand that it can be initially just a focal patch of alopecia. You might not know that this is, Demodex. But if you try to take a tape and for Demodex, you need to do deep skin scraping. But I have been lucky enough that with tape test also it's possible. The only difference is you have to squeeze it very hard of the skin so that this, Demodex come on the tape. You can actually try that. It works very well. So you can see that there is multifocal, it can be focal, it is diffuse alopecia, and it is classic blue-gray hyperpigmentation in chronic cases. This is two dogs. This is a pug actually. Pug was being treated for dermatophytes for a very long time, and he is actually a 2-year-old boy. And when I did, a tape test, I saw multiple Demodex. The second one is a classic demodicosis. This is generalized demodicosis with secondary infection. So yes, I could see pustules, but there was secondary infection. So I had to treat with both the pyoderma as well as demodicosis. Otitis or otodectus. Earlier, otodectus was very common seen on cats, but now because of the breeders where they keep cats and the dogs, recently a lot of Shih Tzu puppies have come for non-stop scratching. The Shih Tzu puppies, when they come to us, we have now made sure any Shih Tzu puppy which comes for a regular checkup in the initial as a puppy, we do check their with the otoscope, and unfortunately they don't have this kind of the crust or anything in the ears, so you cannot do it under the microscope. You need an otoscope and you need some time to check because one or two otodectus may be there, and that can actually cause severe itching, and the ear is absolutely clean, you feel everything is okay. So this is not a case of dog, but you can actually see, there's a party going on for all this. All right. Now let's talk about the allergic skin disease. Atopic dermatitis and food allergy. I think this is one topic where it can go for hours and hours and hours. It is that bad. So I would, look at I'll not go in detail about it, but we are going to talk about the classic lesions. As I showed you for malassezia, the classic is ear pinna. The paws are red. There is furuncles. There is redness. The dog might not be scratching, but the dog must be licking or rolling and must be rubbing. There is always secondary infection like staphylococcus and malassezia, which complicates the canine atopic dermatitis. You can see this is a beagle with a chronic. These are both two different dogs, actually. And finally, I'm talking about contact dermatitis. Now, contact dermatitis, how do you appreciate the difference between contact dermatitis as well as atopic dermatitis? The difference in the initial stages is, in case of contact dermatitis, from top to bottom, the entire body may be affected, okay? But the ear pinna may not. But in case of atopic, you will always see that the ear pinna is affected and not the entire body may be affected. You might see the axilla and you might see the abdomen. But this middle portion of the trunk area or the chest area may be spared. So this is how you differentiate. But again, this is in the initial. If it is a chronic atopic dermatitis, I don't think then the contact allergy, it's difficult, to differentiate between both of them. This is contact dermatitis because of a chemical. Okay, this is where a dog actually had a chemical burn because of some kind of a reagent that the owner had used for plants or something. So I'm not sure. I'm not able to remember this. All right. So now let's talk about the diagnostic approach. Now we are talking about the infection first. Okay. Now I'm going to go a little faster because it's quite easy to understand. When I'm talking about a diagnostic approach, the first is infection. Now, the first is you're talking about the performed cytology. I'm sorry, what is this happening? Anything? Not from my screen, actually. Okay. Sorry. So let's talk about the infection. First is you have to perform the cytology. You perform a cytology and cytology is a must in any case of dermatology. Any case of dermatology, cytology is must. Anywhere you attend a lecture and you will always see in ICVD, Dr. Sonia was there and throughout her lecture, she said cytology, cytology, cytology. So in case of cytology, first you do a cytology and you see first whether there is cocci or rods in the patient. Now you have seen cocci or rods. First, check whether this dog was kept on any antibiotics or not in the recent time. If the dog is not kept on any antibiotics anytime, then you can start with systemic antibiotics, but prefer going with topical antibiotics. Actually, I used to also start with antibiotics immediately. I'm trying to make a difference with my mentor now, or I'm checking with all these dermatologists are talking about. Go with the topical if it is not extensive. If the lesions are not extensive, try going with topical chlorhexidine. Try with shampoos. Try with sprays. If you have to start with systemic antibiotics, always go with only one thing, and that is start with antibiotics of the first generation. Please do not start with higher generation antibiotics. Don't immediately go for enrofloxacin. Don't start with doxycycline, or recently we are talking about meropenem, linezolid. Please don't start with this. It's an earnest and request to everyone. If by chance this dog was already on antibiotic, you have seen that this dog was on clindamycin already, or this dog was kept on cephalexin already. So now you want to start with another antibiotics, then go for an AST. If you try to communicate with a client and tell them, what, your dog has already been on the basic antibiotics, I need to start with a higher generation antibiotic, perform an AST and see culture sensitivity test and see which antibiotic is sensitive to that, and only start with that antibiotic, looking at the MIC, looking at the sensitivity, and then start with it. Meanwhile, since there is 4 days, 4 days are required for the test or 5 days required for the test, tell the client, I'll start with some topical antimicrobials, something like chlorhexidine, something like shampoo, something like spray. Please try doing that and don't start with the higher generation. You know what? This dog was kept on clindamycin. I'm directly going on linezolid. I had a dog from a place, from this different city, and this dog came to me, and the dog was given linezolid. It was so heartful, and it's bad to see that our vets are giving linezolid at this stage where not a single antimicrobial was given to this dog before. Perform, yeast. Do the cytology to identify the yeast. Now, if there is yeast infection, I prefer starting with only topical unless and until again it's extensive. Chlorhexidine works very well, or you can do the chlorhexidine with miconazole combination. But I otherwise, if required, I start with itraconazole at the same time. Then comes the ectoparasites. Okay, now we are talking about ectoparasites. First, rule out fleas. Fleas is flea combing. It's very easy. You find the flea, you find the ticks, and you know that this is because of FAD. But if it is not flea and you have to do the skin scraping, do skin scraping. When you're talking about skin scraping, you do the superficial skin scraping where you can see the Sarcoptes, or else you can go with deep skin scraping like Demodex. Once the treatment is there, either you go for spot on or else you go with fluoroanil, and it's very easy. Then comes food induced allergy. Okay, I think how much time I have? I still have time. I think I should be doing good. So food induced allergy. Now, food induced allergy is very important to understand, because if at all you do not rule out food induced allergy, you are not going to rule out atopic dermatitis. Please, it's absolutely necessary that you rule out food allergy and then you go for atopic dermatitis. Okay.
Please mute your mics, participants. Dr. Madhavi, please kindly unmute because I have muted all the participants. Yeah, kindly unmute.
Okay. Right?
Yeah, yes, audible.
Sorry, I'm very bad with using of these
Yeah.
computers. Okay.
Yeah.
So I hope I'm not boring you guys. I hope it's not that boring. Okay. So let's talk about food-induced allergy. When I'm talking about food-induced allergy, we are talking about the first is the elimination diet trial. I have seen that when there is a system when you are going with atopic. I do not rule a dog atopic unless and until I have ruled out food allergy. Please make sure that you rule out that he is not. And when you're talking about food-induced allergy, you're talking about the elimination diet trial. That means either you're going with a single protein and a single starch. When I'm saying single protein and single starch, that means not a single day for 2 months, you cannot give any other diet. I have so many dogs coming to me, so many dogs with a dog. I'm talking about recent, just 4 or 5 days. This dog is kept on hypoallergenic diet, but he's given once a week chicken. It's very important for you to understand when you are doing either an elimination diet, means you are talking about a single protein, or you are going with a hydrolyzed diet. You cannot give something else in between, otherwise it's of no use. So you are talking about elimination diet trial. You check with one protein, one starch. See if this dog, for example, I'm talking about chicken and rice. When I'm telling he cannot give treats, the owner cannot give treats. You cannot give curd, you cannot give buttermilk in between because milk is a different protein. You're talking about food, you cannot give treats because that treat may contain some corn. You can have corn starch, anything. So you start with a single chicken and rice, and for 2 months, not 1 week, not 2 weeks, for 2 months, see if there is pruritus is resolved. If the dog is still having pruritus, then you can go with an environmental allergy, or else you can go with a hydrolyzed diet trial. You're talking about hydrolyzed diet trial means the food particle isn't so small, the protein is so small that the dog does not react to that protein. But again, you're keeping on a hydrolyzed diet. You cannot keep him on that hydrolyzed diet only and give chicken in between, or you cannot give some treat. Each food trial should be for 2 months, that is 8 to 10 weeks. Now, if the dog has resolved, the pruritus has resolved, don't be happy and tell the client, you know what, the dog is not allergic, it's food allergic and my work is done. No, this is where we all again go wrong. If the pruritus is resolved, then you have to again conduct provocation trial. You know why conduct provocation trial? That means you started the food trial in the month of August, probably. Okay, you started on August and September. Or let's start September. So September and October, in the month of November, this dog stops scratching. You think that this is because of the food. There is a possibility that the rain stopped and he was seasonal atopic. And that is why once you stop that, the rain stopped, the dog has stopped scratching. And you think that 2 months of trial, this dog was kept only on this particular protein. And that's why the dog has resolved. So that is why, to differentiate that, you start conducting a provocation trial. What do? You again give something that he has eaten before, which he was itching. So you start with, if you have given a hydrolyzed diet for 2 months, the dog has stopped itching, start again chicken or probably the previous food, the dog food he has, tell and see if he's again itching. If after giving that, he has started scratching again, then you say that, you know what, I think that dog is food allergy, and then you can confirm that this is food allergy. This is how. If nothing has worked in your diet trial, you have been very specific, then you confirm that this is canine atopic dermatitis. I'm sorry, why is this not moving ahead? Okay. Now, environment-induced allergy, we know we are talking about glucocorticoids. I'm not talking about the treatment today much. Glucocorticoids, oclacitinib, you can talk about modified cyclosporine and lokivetmab. These are the trials. ASIT is something that we are not, immunotherapy, we are not still using. I have not used it ever, so that's why I'm not going to talk about. But this is about the general treatment of atopic, glucocorticoids, oclacitinib, modified cyclosporine, and lokivetmab. So last, I'm going to talk about the diagnostic workup. As I just mentioned, infection diagnostic workup, infestation diagnostic workup, and allergy diagnostic workup. Infection diagnostic workup is something that you're talking about the cocci as well as malassezia. So cytology is important. So you need a glass slide. You need to see whether it is dermatophytes with Wood's lamp examination. Do a KOH test, do a cotton bud for malassezia, and do culture and sensitivity. Look at this. This is actually a dermatophytes. This is a photograph of malassezia. This is actually malassezia on the skin, okay? On the skin. This is very important. Look at the culture. So this dog actually is an atopic dog. This dog was doing very well. He was being treated by the primary vet. The dog was doing very well with atopic. He was doing, good. But recently, and he was on oclacitinib. Recently, he came to me for a second referral, and he said that now this oclacitinib is not working. I looked at the dog, and entire patch was red, and he was right. It was red. So I was not convinced that why oclacitinib has stopped. So I just did a cytology. This is the same cytology. When I did a cytology, this is a beagle actually. It was entire malassezia. So what happened is when they went to the primary vet, the vet thought that this oclacitinib has to be increased. The dose had to be increased, and still it didn't work. So the owner came back. Nothing went wrong. The treatment was absolutely right. The only difference was because of the seasonal flare-up, there was malassezia, and that was not treated, and that's why the dog still didn't stop itching, because this itching was because of malassezia, not because of atopic. This is dermatophytes. You can actually appreciate such beautiful. This is microsporum. You can see that the rest of the hair shaft, they are so good. And this hair shaft is actually full of spores, Then comes the next diagnostic workup. You're talking about coat combing, the same thing, skin scraping. It can be superficial for Sarcoptes. It can be deep for Demodex. Squeeze tape impression. I love it. You just have to take this skin. Here, this is the skin. I hope you can see. You just have to squeeze it multiple times. You keep squeezing, squeezing, squeezing. And once you start squeezing it, you take a tape over it. You press it hard till the dog is uncomfortable. And then you take it on a tape. And you can actually see a lot of Demodex or even sometimes Sarcoptes. Ear smear for ootic parasites, trichogram, and squeeze tape impression. So I didn't mention, I hope you know about this. This on the left-hand side is actually a beautiful photograph of nits. Okay, this is a lice infestation. This is the photograph of the same lice. So this dog had come to me where poodle, it's very commonly seen in poodle. The poodle was non-stop scratching all over his body. He was scratching, scratching, scratching. I checked for fleas. I could not find a single flea. It was a black poodle. I could not find anything, anything. And when I was observing him, but the dog was scratching, I checked for other things. There were no lesions, nothing. But then when I kept observing this dog, at least like a 2, 3 minutes, I was observing. Literally, I felt like I'm a monkey who's observing this dog, between the hair. I observed and I saw that it's something like, sprinkle of white dust all over, there was white dust. So what I did is I tried to dust it off and it didn't come off. That's when it clicked me. So the nits, sometimes you might not see lice, but you will find the nits. And these nits are actually sticking very close to the hair shaft, not on the skin surface, but on the hair shaft. If you try to remove it with hand, it doesn't come off. They are very adherent. Or simple, you have to actually, with a flea comb, I have tried. Some vets tell with a flea comb it's possible. It's not possible for me, or with a toothbrush. So what I do is I just, wherever I find those white particles, as if someone has dusted some sugar on the body, I just clip that hair, a little bit of hair. I take it on a tape, on a tape, on a slide. I put the tape, the scotch tape over there. And I see under the microscope, you can see this bullet shaped, nits of this lice. Beautiful. The moment I saw this and I'm like, yes, there are lice infestation. I just have to start the treatment for the lice infestation. This is Demodex. You can see the other photograph. There's a party, and this is all with just simple tape test. Okay, I was able to do it with tape test also. Oh, these are live tapes. I've told this story multiple times. I'm this. If in Demodex, it's very difficult for owners to accept the fact that you have to use fluoroanil, which is expensive, and how to give. Many times in IAVD, this discussion is going on that it's very difficult for the owners to talk about how to give this medicine. It's so expensive. I have a very simple rule. I just take the tape. I put a nice screen. I have a nice screen attached to the microscope. I just show the owner the live mite, and the moment the owner sees the mite, they get so freaked out and they're like, oh God, is this on my dog? Is this mite moving on my dog? And I'm like, yes, it's moving on your dog. Is this just one? And I'm like, no, there are multiple. The moment I say, I say, you know what, I can do this. I can take care, but you have to please start with something which is, it's expensive. But the moment they see this mite moving and they're like, just get the hell out of my dog and just start with the treatment, and they're ready to pay for that. Oh, these are all live ones. Okay. Then comes allergy diagnostic workup, and same thing I had repeated is just first to eliminate the dietary trial, start with a single protein and a single starch. If it's not possible, go with a hydrolyzed protein. And if you do it, please do it for 2 months. Do not introduce something else. You're just making the owner spend the money by giving hypoallergenic food or analogenic food. And if you're not giving any, giving in between any protein or treats, it's wrong. It's absolutely wrong. It's just something that you're making a mistake. Then comes environmental allergen workup. Intradermal allergy testing, IG serology test is something that the sensitivity and specificity is still not that good. So the best way is to first rule out food allergy, and then you can actually go and work with, starting with the medications as a trial. Contact dermatitis, avoidance and re-challenge, and second is patch test. I'm not sure, I did try. Patch test is where I had this one case where the owner was not convinced. He said that I have a lot of plants. I don't want to remove all the plants. So I wanted to do. So what I did is I took leaves of these plants, I did crush it and I put on the tape, the tape, the surgical tapes. Under the surgical tapes, I shaved that area, but it was little difficult. The dog was not able to, the dog was non-stop scratching. And by the time the owner came back to me, it was the entire patch was red. So I was not able to identify which side and which started later on. So it didn't work for me. I didn't do it well, probably. I'm not sure. So finally, I am talking about differential diagnosis. Major, which we see on a rare to day-to-day practice, is parasites, fleas, lice, sarcoptes, demodex. We are talking about infection, that is bacteria, yeast, dermatophytes, allergies like flea bite allergy, cutaneous adverse food reaction, atopic dermatitis. This is which is very common. Major in the sense day-to-day practice. Uncommon to rare, we are talking about parasites like otodectus, as I said, more likely in puppies. I am seeing a lot of otodectus. Please make sure that any Shih Tzu puppies, if it's scratching on the ear, always first rule out otodectus, second rule out sarcoptes, and then you move ahead to the food allergies and everything. Then comes hookworm dermatitis, mosquitoes, drug hypersensitivity, possible immune-mediated diseases like pemphigus foliaceus, neoplastic, and psychogenic. I would like to talk about neoplastic. I think I have the photograph of this. Yes. So this first dog is actually, this dog came to me saying, on the phone only they mentioned that we are getting a dog, there is a wound on the leg and it's almost 4 vets have treated and it has not responded to the treatment. And when the dog came to me, I was like, okay, you can get the dog. The moment this dog came to me, this is a beautiful lab. The dog's name is Pearl. She came to me, and the moment I saw this dog, I knew something is not right. Without talking with the owner, without talking to the owner, I immediately did a cytology and I saw mast cell. It was a mast cell tumor, and that's why it didn't improve. I sent this dog to the cancer vet, it's in Pune, and they treated. They started with the treatment, but they mentioned that later on it had spread to there was metastasis in the lungs as well as on the spinal cord. So, what I want to tell you is they told me that had this dog come a little earlier, around 1 month or 2 months before, and they were being treated for 3 months, just do a cytology, probably the dog would have survived. I'm not sure. I lost this touch about this case, but I think they decided to take the call because it had metastasized to the, the spinal cord. This second dog, a cat, is actually a cat photograph. This cat was actually came to our clinic. I was not there. One of my junior treated. She thought that this is a bacteria. She didn't do the cytology. I was not available in the clinic. She didn't do a cytology. Started with chlorhexidine spray. She thought it's a classic pyoderma. After 7 days, this cat came back to me. That time I was available. And she said, you know what? The owner said, it's not improved at all with the spray. So I did a cytology and I saw acantholytic cells. This cat was actually a pemphigus. I did biopsy. I confirmed it's a pemphigus. And then we started with the treatment. So then I told my junior, my vet, that cytology is so important, because if had we not done a cytology, this owner would have just shifted to somewhere else, or probably we don't know what happened. Management approach is always manage the owner's expectations. Please understand, I'm telling you, but it's difficult for me also. When it comes to dermatology, we talk with the client. And in spite of talking to this client for almost half an hour, after 15 days when they come, or 1 month they come for the second follow-up, again, I have to tell the same thing, because this time she understood, but the husband didn't understand. So I had to speak. So yeah, it is difficult. We had recently a lecture session in PPM. It was a wonderful session where they actually told us that, she explained us, how to understand the owners when they are angry, and it did help. So I think we can have a lot of sessions. There are maybe seniors who can tell how to manage the owner's expectations. We are all learning about it. Strategic use of antipruritic therapy where appropriate. This is important. You can start with glucocorticoids. I do start with glucocorticoids. I do love glucocorticoids. But if it's an allergic case, yes, I start. But sometimes, even if it is, dermatophytes or malassezia, I know this is not the drug of choice. This is not to be started, but for the first 3 days, just to reduce the inflammation. When there's malassezia, there's dermatophytes, there's entire itching, there's redness, there's erythema, there is inflammation. The owner is miserable seeing the dog scratching. So in that time, there is no harm for starting for 2 to 3 days. in a very, very lower dose so that the dog inflammation will reduce, and then you can start working on the medicines. At least then the owner is comfortable. But if it is a sarcoptes, don't start. If it's a demodex, don't start, because that will just worsen up your condition. Treat the primary cause, reduce the pruritus, and then resolve the skin lesion. The whole topic about how to approach pruritus is not to decide what treatment to give, but what to diagnose and how to approach. If you have approached it well, you know what it is, and then you can start the treatment accordingly. Avoidance of the strategies, adjunctive treatments, improve the barrier function. This is very important for me recently. This is, improvement of the barrier function is so important, because in case of atopic, how much ever you try management, how much ever, I had recently given a session on, on atopic dermatitis. How much ever you try to work hard on a topic, you have to understand, you start with ocloxetinib, you start with cyclosporin, you start with locuvitamin. But if you're not able to maintain the about the barrier function, it doesn't work. So you need to take and maintain the barrier function also. You need to maintain the reducing of the transepidermal water loss. Implement strategies to prevent recurrence of signs. Always see what is secondary and always find out what is the primary cause. Managing owners' expectations. Therapy should be based on a definitive diagnosis. During the diagnostic process, appropriate antipruritic treatment should be given for the symptomatic relief. As I said, if it is an otitis case, there's a lot of inflammation. You need to give glucocorticoids for the first 2 to 3 days so that the swelling, the inflammation in the ear canal reduce. If you don't give that and you try to put your ear drops, the dog is going to bite the owner and the owner will stop putting ear drops. So ultimately, it's not going to help you. Proper communication with the owner is important. Explain the owner that this will take some time. Please give me time to understand what is wrong with your dog. Strategic use of antipruritic, this is appropriate. If it is a flea allergy dermatitis, yes. If it is sarcoptes mange in the initial stage, yes, atopic dermatitis, contact dermatitis, but not appropriate if it is demodicosis. First line of treatment of pyoderma, no need to start. First line of treatment of malassezia dermatitis, not required. But if it is chronic, where there is a lot of inflammation, yes, you can start. Flea and mite treatment and prevention. For fleas, we all use selamectin. You see fipronil. I love fipronil and esmethoprene. That is my first drug of choice. You can go on selamectin. You can go on imidacloprid plus permethrin. But I'm very happy with fipronil itself. For Demodex, we use fluoroanil. We know now we have a lot of options for fluoroanil. You can go with afexolaner also, and you can go with sarolaner also. Antimicrobials. Antimicrobial agents like chlorhexidine shampoo, dilute bleach rinse. I have started using dilute bleach rinse also. It is a little difficult to explain the owners, but we can try. Antibiotics, I prefer going with fusidic acid ointment and mupirocin ointment. But if it is a moist eczema, it works. But if it is very hairy portion, I prefer going with chlorhexidine spray, so it's easy to apply. Antifungal agents like miconazole and chlorhexidine shampoo, also as clotrimazole shampoo or creams. Systemic antibiotics always go on based on AST. But there is a guideline given about antimicrobials, the first line of treatment, the second line of treatment, please, you can go. It's easily available on the net. You can actually take a printout and you can put in your drawer, just to check. Systemic antifungal like itraconazole and fluconazole. I love itraconazole. I'm still not convinced with fluconazole so much. I'm very happy with itraconazole, so I go with itraconazole. Reduce pruritus and resolve skin lesions. We all know about ocloxetinib, cyclosporine, and glucocorticoids. This is a big, long, lecture that can happen. 1 hour, 2 hours also sometimes is less, and it's insufficient. Avoidance of strategies like avoidance of storage mice. Now, this is important in case of food trials. I always believe in using or taking care of storage mice. Now, what is storage mice? There is a concept. If your food is kept, these bags, you're talking about hypoallergenic bags, you're talking about allergenic bags, these hydrolyzed food. Okay, you have to understand that if you're going with elimination trials or you're talking about the provocation trials, you always start with a small bag. So these storage mice, they are responsible for causing hypersensitivity in these same dogs who are already allergic to food. Okay, so what happens is these mites are able to enter in the normal polythene bags. They don't have to have a hole in your bag. It can be seen in a normal bag. So if you have to take care, either you start with a small bag, tell the owner that I'm going for provocation trial, buy a 2 kg bag, or else use containers which are airtight containers. Avoidance of known environmental allergens and avoidance of other trigger factors. All atopic dogs, all food allergy trials, please make sure that these dogs are kept on spot-ons like fipronil spot-on. This is very, very, very important. Otherwise, the dog will start scratching because already he is hypersensitized, already he is hypersensitive, and he is itching because of fleas, and you start blaming the food trials. Adjunctive treatments like antihistamines like cetirizine, hydroxyzine, and fexofenadine can be used along with adjunct. I'm not that big fan, but you can use, there are certain vets who are using this along with oclacitinib or anything else. And implement strategies to prevent recurrence like topical glucocorticoid therapy. Please, if you are using topical glucocorticoid therapy, explain the owner that has to be used maximum once a week or once in 2 weeks. It should not be used every day, or there is a high chance of getting iatrogenic Cushing syndrome. The way I showed, the vet was not probably at fault. He must have given the cream and he told the owners to apply, for the redness is gone. But what does the vet understand? That the redness never went and the owner kept applying it. So it's not fault of the owner, vet. The owner started blaming me, blaming that vet. That vet told me he should have not told to apply. I said, did the vet told you to apply for 2 months? He said, no. He told till the redness is gone. Then if your redness is not gone, then why didn't you go back to him? He didn't tell you to apply for 2 months. So it's very easy to blame the vet for that. So please make sure you explain that to the owners. Improve barrier function. As I said, you can use oatmeal shampoo, use oral and topical EFAs, ceramide complex shampoos, and you can use fatty acids and antiseptics shampoos also. It is absolutely necessary in atopic dogs. If you are not able to take care of the transepidermal water loss, if that barrier is not maintained, the skin gets very fast exposed to the allergens, and that's why the dog starts scratching. All right, so I'm on time. The lecture started around in 6:20, so I tried finishing it in 1 hour because I don't want you all guys to get bored and you want to beat with your family. There is a dog's barking, and that's my kid who is barking. I think he understood it's 1 hour. So take home message. Please identify the flare factors. Cytology is a must. Please understand, diagnose the primary disease, treat the pruritus first, and then you can move on and tell the client or communicate with the client that I want to go with the food trials. If you are doing with a food trial, you are taking care of atopic dermatitis, but you're not taking care of the itching, the owner is not going to wait for 2 months, I know he is allergic to chicken, probably. You are giving an hydrolyzed diet. But if you don't take care of that itching or pruritus during that 2 months, the client is not going to wait for 2 months. So it's important to communicate to the client that I have started food trial. But if he starts itching a lot, I need to take support of either oclacitinib during that time, glucocorticoid during that time. This is way how you communicate. And as I mentioned, skin barrier function is very important in doing any pruritus, because basic pruritus means there is dryness of the skin. If you are able, it's simple. You have a dry skin, you start scratching during the winter. You apply a moisturizer. It's not possible to apply moisturizer to a dog. So the simple way is use something which will take care of the epidermal barrier. All right, so these are the some guidelines that I have gone through, and this is the next, right? You can go through these articles. They're beautiful. These are focus journals, and it's amazing. All right. Thank you so much. Yes.
Thank you. Thank you, Dr. Madhavi, for the enlightening and wonderful session. It was full of expert insights, and I must say, all the participants, they must have gained a lot from this particular session. So now, a gentle reminder to all the participants to kindly fill the Google link in the chat box to receive their certificates. Please note that the participants who fill the form will receive the certificates. So it is mandatory. Kindly fill out the form. And also, I will now invite the Drools team to present our ongoing initiatives in veterinary education and share details of the upcoming webinars. So we have a series of upcoming webinars in the coming months. So as and when the links will be out, you guys can fill out the links to participate in the upcoming sessions. So we have a talk on insight to the diagnostics and management of the hypothyroidism in dogs. And in the August month, there is mite infestations. And in September, we have a talk on dermatosis from the homeopath's viewpoint. So we have a series of upcoming webinars. Don't miss to check them out. So it's time for our interactive Q&A. If you have any questions for Dr. Madhavi Awale or any doctor from the IAVD team, please drop them in the chat box. Please drop the questions. If you have any questions for Dr. Madhavi, please drop them in the chat box. And also, don't forget to fill the link to receive your certificates.
Okay, so I'll do one thing. I'll start with certain questions. There are a lot of questions. I'll start with.
I will just read out few questions. So
Yeah,
once they are in the
please.
chat box, so
Yeah,
it will
a
be
lot, yeah.
smooth for you also. So there is one question from Dr. Ramya. Is dairy products, they enhance the pruritus in pets?
See, if I have seen a lot of cases with dairy product also as one of the allergen, okay? Because see, ultimately, when you're talking about protein, milk protein is also a kind of protein. You can have with chicken, when you're talking about the, the protein allergy sequence, Dr. Thierry Oliveri and Dr. Ralph Mueller has given a nice, they have done extensive research in US, and they spoke about the percentage of this. They said that beef is the maximum percentage having, the allergies are maximum of beef, the dogs with beef allergy. But I think that is different in India because it depends upon the exposure of protein that is maximum done. So in India, I have seen milk, dairy, and chicken allergy maximum. Whereas in cats, fish allergy, I've seen maximum because you know what, the exposure of fish is more. Whereas in India, because we believe in milk products a lot, those dogs who are not kept on chicken, they're not kept on non-veg, milk protein is very commonly given. So yes, I have seen it. I won't say enhance, but I would say that, it depends on the exposure. So yeah, milk protein also allergy is seen.
All right. So we have one more question from Nivedita. So she's asking, how do we brush or take the sample for fungal culture? And what kind of brush can be used?
Okay, so for fungal culture, what I used to do till now, till my ICVD, okay, till ICVD, I used to do trichogram. Okay, trichogram is where I do two-way. I pluck the hair around the lesion. I pluck the hair. First, I do the Woods lamp. I confirm it's not microsporum. Then I take a hair and shaft and I see under the microscope under low power, where I'm just looking at the density of the hair shaft. I'm looking at the telogen, where is the allergen. I look at the hair shaft. And third is I do a KOH treatment. I take a hair shaft, I put it on the slide, I take a drop of KOH and I see under the microscope. That is one way. But recently, with Dr. Sonia was there, and I had gone to AMMs there, Dr. Mathuravan was there. So they both gave a beautiful way. They said, stop doing trichogram. I'm still doing it. I'm not getting used to that other method. They say that they just take a scotch tape, and wherever the lesion is there, they take a tape and just do this, just like press leaf, press leaf, press leaf, press leaf, and they take it and then they stain it. They stain with your regular staining. What I use field stain. You do field stain, you do diff quick, and then see the hair shaft around it. It's a little difficult for me still. I'm getting used to, but I'm trying to do it every day. As I said, this is practice makes perfect. But I'm learning from them. So yeah, these lectures, these sessions, what ICVD does, and these sessions, these lectures others do, these webinars we have, that helps a lot to change our way of diagnosis. So this is another method that you can do.
Yes, we have one more question, doctor. So Dr. Praveen is asking for the food allergy test. So what are the food allergy tests that can be used? I guess that is the question.
The food allergy trial, food elimination trial is the only gold standard method. I don't believe there is any serological test for that or blood test or anything. I don't believe in that. For food trial all over the world, all the dermatologists, they are a big fan of only one, that is elimination diet trial. So as I said, you do the elimination diet, you just change with one protein and one starch, restrict it for 2 months, or else then you go with food elimination like hydrolyzed diets. We have a huge range in India with hydrolyzed diets. You can go with analogenic, you can go with hypoallergenic, and then after these food trials, like this, you do the provocation trial to confirm that this is food or this is environmental. There is no other method, no shortcut for that.
All right. So one more question from Dr. Jairam. He's asking, nowadays heavy cases of dermatitis in dogs and cats are coming. So whenever humidity is increasing, so these cases are in increase trend. So he wants you to elaborate more on this.
Okay, so I'm just looking at this question of Dr. Okay. Yeah. Okay. So in case of, we have humidity is a very major problem for us, especially in the southern and the western part. We have like the Mumbai, Pune, and the southern, we have a humidity. So we have to understand that if we are talking about humidity, we need to do the cytology to confirm what it is. Are we talking about malassezia? Yes, when there is humidity, we do see malassezia, a lot of cases. Are we talking about dermatophytes? I remember when I had gone to Kerala, most of the vets were discussing about malassezia. Initially, I did not understand why they were so fixed on having malassezia to be talked about. But then later on, I realized that they have a lot of cases of malassezia. The only way is to diagnose what are we dealing with. Are we dealing with humidity? Are we talking about atrophic with the seasonal flare because of the this, or are we talking about humidity and that's why malassezia, or are we talking about humidity and dermatophytes? Only and only if you do a cytology are we able to differentiate between this, and then you figure it out. If it's malassezia, why is it malassezia? Is it because of the structure? If you are talking of brachycephalus breed, you have these folds, and because of the folds and the humidity, there is continuously the moisture gets trapped, and that's why malassezia. Or is it because in the axilla or in the groin region, is it because of some kind of a food allergy? So understand that it's not about just humidity is one of the trigger factor. It is not a reason for skin infection. It is a trigger factor, but you need to understand what is the primary factor for that.
Okay. So next question is from Dr. Sanjay. He's asking any suggestions for flea infestation in newborn kittens and puppies.
Yeah, I have got this, a lot of, in this case, lime sulfur helps, okay? In 6 weeks and under, you cannot use it, no? You cannot use for these. So you can use these lime sulfur. Lime sulfur is safe even in case of small kittens and puppies. So I have used lime sulfur dips, or you can use lime sulfur sprays. It helps to some extent.
Okay, all right. So the next question, participants kindly mute yourself. Dr. Madhavi, I request you to please kindly unmute. I have muted all the other participants.
Okay,
So the next question is from Dr. Sanjeev. He's asking the line of treatment for pruritus.
I think it's the same thing we talked about today. When you're talking about treatment of pruritus, what is the pruritus for? As I said, the whole lecture was about that. The treatment is not about pruritus. Why is it? What is it causing the pruritus? Figure it out, diagnose it, and then you treat. See, treatment is very easy, very easy. You just go on Google, even the owners know how to treat. It's very easy. Half the time the owners come up with some, our clients are very intelligent. They are very well read than us. I think we don't read that much. How much the client? I have certain clients who send me articles. They send me abstract articles to me, about food allergy. It's so funny. It's sometimes funny and it's sometimes just shocking also. So understand, it's not that. The treatment is not difficult, but our job is to diagnose. So you approach and you diagnose. Once you diagnose, then go on Google also, or you call one of our friends, fellow vets, and ask the treatment. It's easy. Just diagnose it.
Okay.
I hope I answered.
And one more question is from Dr. Manav. He's asking for some important tips to use for the Woods lamp test.
Woods lamp is the easiest, the most easiest and the most cheap thing that you should have in your clinic, and it's so easy to use. First is that when you are using a woods lamp, you are supposed to plug in and switch off the lights and let it heat. So ideally, there are certain vets who mention that the apparatus should be heated for some time, but recently, I feel it's not the apparatus that has to be heated. I think I should get used to the darkening. So it's important that the room should be completely dark. My derm room has no window for that reason. I have made sure that my derm room has no window so that it's easy, it's black. So I switch off the lights and I switch on the lamp and I talk to the client during that time. During that 5 minutes, the machine also gets heated up. At the same time, my eyes get more accustomed to the darkness, and then I start looking it. Now when you're looking for the with a woods lamp, please don't look at the lesion directly. This is the biggest mistake. You start from the head to the tail and go slowly, and when you're going, just don't go on this. Try making sure that you take the hair shaft around so that you can see under the hair. Sometimes you might not see on the top, but you can see at the base. When you're doing a woods lamp, it is not the skin should not glow, the hair should glow. So sometimes my juniors, when they come to me and they said, ma'am, it's glowing, it's glowing, and I go there, I see it is the skin, because sometimes the owner has applied and that is why the skin is actually glowing. It's not the skin, it's the hair shaft. So I've given a very nice tip to my juniors. I tell them to pluck the hair. You think this is glowing? I said, okay, fine, no worries, just pull that hair, go away from that cat or go away from that dog, and just then take it and see under the this woods lamp. Now also, if it is glowing, that means your hair is there. But don't be happy it is microsporum. Take that hair, take it on the slide, see under the take a KOH drop and see under the microscope. Easy.
Okay, all right, doctor. So one more question is there from Dr. Nivedika. She's asking, going with the vegetarian diet is okay, would be an option in food elimination trials.
I had tried a one, but I'm not very happy because the protein requirement then becomes very less. I've tried, there's one patient, one Oreo lab, but it's so difficult because it doesn't take care of the protein requirement and there are other complications. So yes, I would like to go for hydrolyzed diet, tell the client, explain the client. Nothing works. You can go on a vegetarian diet, but I'm not sure what kind of protein you will take care. Soybean and something you can try, but I have seen. I'm not happy. I like to give a good protein diet to dogs because ultimately you're talking about skin means protein, right? It's everything about protein. So yeah.
All right. So one more question is there. So Dr. Priyanshi is asking, spot-ons cannot be used in very small puppies and kittens. So in that case, what can be the line of treatment
Yeah,
for?
I think I just answered lime sulfur dips you can use. It's the same thing. I think it's the
All
same
right.
question.
So one more question is there. She's asking, what is your opinion about giving raw fish to the cats?
Yeah, raw fish can be given to the cats. It's not that many clients, and there are certain vets also who go with diet. You can go for raw fish, but I am not a big fan of giving anything raw because of the way its hygiene is maintained during the travel. That is my problem. The way we process, the way the fish is from the coastal area, the way the transportation is there. So I'm not a big fan of anything raw. But that is my opinion. There are many vets or many dog trainers or dog breeders who say that this. I have some vets from Belgium. They are a big fan of giving raw. So their dogs actually eat raw beef. But the only problem is I'm not convinced with the transportation. So
All right. And Dr. Nikita is asking how to take biopsy samples.
oh, biopsy sample, it's not that difficult. I do biopsy. I use punch biopsy. You can go with a 6 mm, 8 mm, and 4 mm. I have 8 mm is something is. See, I hate surgeries. I do surgeries with my help of a surgeon. So I'm not a big fan of surgeries. So I like anything which I don't have to stitch. Or my fellow vet or my husband, Dr. Gansham, he does it. But I hate to do the stitching and everything. So if it is on the back anywhere on the flank region, I just take a 6 mm or 4 mm punch. I just do a little local, not injectable, because then it can change the structure of the skin. So I like to just do the lidocaine application on the skin, tap it for some time, leave it for 10 minutes. And after that, I just take squeeze. You just have to take a punch. You just squeeze in one single direction. You keep doing that. And then you pull it out. You take the punch and you put it in the formalin. If it is on the nose, I have done on the nose, nasal planum or something on the face, then you have to give anesthesia to the dog. So I do take I don't take care of the anesthesia. The anesthesia is again taken care in my clinic. So there we have to do. So you don't have to staple. So I do a 4 mm. In 4 mm, you don't have to staple or anything. It heals on its own. But for 6 mm, I just do the staples. It's quick and easy. As I said, I hate stitching. I hate surgeries.
Okay. So the next question is by Dr. Nilesh Dagli. Can you please recommend some ideal training centers for dermatology disorder diagnostics?
ICVT workshops. We have ICVD now in India, so let's go for that. You start coming for workshops. We have beautiful workshops there, and you can start with next. We had this time beautiful workshop conducted by Dr. Sonia. She explained in so much detail, so much detail and so much to learn, so much to learn. So you can start with that. We have a lot of lectures. Next time it's in Calcutta. So yes, in June it'll be. The dates are not out yet, but please start with that, and then you will come across many people who are interested in dermatology, and you meet the same kind of people, the same kind of interest. So it's easy.
All right. One question from Dr. Mayank. He's asking, we get a lot of cases of skin issues in pets living in the coastal areas. So what is the possible cause, and what can be done for the prevention?
Sorry, I didn't get the question. Sorry.
The question is, we see a lot of skin issues in pets living in the coastal areas. So what can be the possible cause and the prevention?
Yeah, the same thing as I mentioned. It's about how when you're talking about we're talking about the coastal area means again the humidity. The south, the west, we all have the same issues. We have a lot of humidity, and this is all because of the humidity. So humidity means again we are talking about pyoderma. You're talking about malassezia. You're talking about dermatophytes. So why is it happening? Is you need to figure out why, and that is only possible by doing a proper diagnostic approach.
Right. All right. So, one more question from Dr. Shriram is there. He's asking, can we extend glucocorticoids more than 3 days? If yes, either we have to go for tapering dose or how the dose has to be given.
Yes, we can extend it more than 3 days. If you know your glucocorticoids is the right drug of choice, yes, you can go. The same question was asked in ICVD with Dr. Sue Patterson. Someone asked this question and I love the answer. Someone asked her, "Can we give it?" And she said yes. Then say next question was, then for how many days? And she said forever. So understand that yeah, I don't give it forever, but if it is something associated with autoimmune, you're associated with pemphigus, you're associated with some kind of a you're talking about a topic. Yes, glucocorticoids can be given for more, but you should know that you're using that right drug of choice. It is the choice of drug. There is no alternative. And then if required, then you can switch on with, you should go for tapering dose. I have gone for 5 days, I've gone for 10 days, I've gone for 15 days in a tapering dose and finally switched to oclacitinib or cyclosporin. I have gone in that way. But I have one dog where I had to go more than 2 months. It's a case of pemphigus. I had tried everything, and we did start. For 2 months he was on glucocorticoids. He was a very bad case of pemphigus, and then now he's doing very well on cyclosporin.
All right. So there is one more question by Dr. Vicky. He's asking, what is the difference between skin cytology and skin scraping?
See, in cytology means you're talking about the cells, right? So skin cytology means you're looking at the cytology. The word cytology means structure of the cells. You're looking at the cytology. So you're taking a slide, you're pressing against the skin to see the lesions. You're seeing the pustules. You're seeing you're seeing malassezia. So that is cytology. You're talking about skin scraping means you're scraping the skin. You're scraping it with a blade so that all the debris comes on the slide. So you're looking for skin scraping in case of some kind of sarcoptes, demodex. This is skin scraping. That is skin cytology.
All right. One question is there, can we give glucocorticoids in sarcoptic and demodetic mange?
See, as I just mentioned in the this, I think you must have missed. In case of Demodex sarcoptes, I avoid glucocorticoids. In the slide, I had written that in sarcoptes for 2-3 days I have done, but for mites, Demodex, no, absolutely no. Sarcoptes 2-3 days just to ease out the dog and the owner. That's all. That's all. But I don't think both. It's not both. Actually, it will not work. Glucocorticoids will not work on this. So preferred as don't use it at all.
All right. So
I think the question list is not subsiding.
it's a long list we have
Yeah.
still with us. So I'll just figure out few important questions from this, and yes. So Neeraj Bhisht is asking, what can be the most preferred antibiotic for the dermatological cases in pets where more diagnostic is not available?
See, my best first is always clindamycin, cephalexin, and amoxicillin. These three are the Dr. Priyanshi has written cephalexin to wonders. Yes, I'm not big fan of cephalexin. First, I start with clindamycin first because of once a day. My problem is owners twice a day. They are so not wanting to give. So it's also upon owners. So when it's once a day, the owners will make some efforts. Twice a day, most of the times the clients, I don't know how your clients are, they must be very sweet. My clients have the time, goli kaise दूं, kahan दूं, kab दूं, kaise, kisme डाल के दूं. And if it's a food trial, the first question is, तो अभी गोली कैसे दे? How to give the tablet? This is the question they have. So I prefer giving it once a day if possible. If not, then yes, I've gone with cephalexin and amoxicillin, both.
Okay, all right. Thank you, doctor. Thank you for taking time patiently to answer all the questions in the comment section. So to conclude, we will invite Dr. Meera to give the vote of thanks. Over to Dr. Meera.
Yes, yes. Thank you. So, good evening, everyone. Myself, Dr. Meera Sakre. So, it is my honor and privilege to vote of thanks on behalf of IAVD organizing team for today's enlightening technical webinar. So first and foremost, I would like to express our heartfelt gratitude to our distinguished speaker, Dr. Madhavi, for sharing her valuable insight, clinical experience with excellent clinical pictures and latest advancement in etiology, diagnostic approach, differential diagnosis, management approach, strategic use of antipruritic therapy for how to approach pruritus in dogs. I am also a sincere thanks to our Association for Veterinary Dermatology India, especially Dr. Nagarajan sir, President IAVD, Dr. Jairam Ramani sir, Secretary IAVD, and entire team for meticulously planning and smoothly executing today's session. We also extend our deep appreciation to participants, different veterinarians, students, researchers, field officers who joined with us from various regions, and your enthusiastic participation and practical questions made this webinar very interactive. We thank to Drools and entire team whose support made this event successful and possible. So thank you once again, and we look forward to your participation in coming IAVD webinars. So stay safe and keep learning veterinary dermatology. Thank you one and all.
Thank you so much.
Thank you, Dr. Meera. Thank you, Dr. Madhavi.
Thank you.
So before we wrap up, a gentle reminder to fill out the form in the comments box to receive your certificates. And thank you all once again for joining us. Wishing you a wonderful festive season ahead. We look forward to seeing you at our future sessions. Thank you. Thank you, everyone.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools.
Drools. Feed real.
Feed clean.